Welcome back to Healthy Living. As we discussed in our first segment, we're going to talk about women's health, and we're going to talk about it from the perspective of women's bone health, which is a very important factor in healthy aging and mobility as you age. And we're going to touch on a few things. We spoke with Dr. Alair, our primary care physician. My guest now with me is Sherling Werner. Sherling is the manager of our imaging services. So she sees a lot of images of things that are healthy bones and things that are not so healthy. So we want to talk to you about that, but I want to welcome you first to the show.
Thank you. I'm glad to be here.
Yeah, we're happy to have you. So thank you for coming. So we are going to talk about women's health. We're going to talk about all those important topics and resources that we want to discuss. But first, I want you to tell people a little bit about yourself.
All right. So I've been affiliated with the hospital for about 18 years now. I've been through the imaging department, diagnostic, CAT scan, MRI, before I ventured into a more leadership role. Personally, I've been married 13 years. I have twin girls. They're going to be 12 this year, going on 16 some days, but they keep me busy, super active. So
that's exciting. Twin girls, that's a lot. That's a lot. So, well, I appreciate, again, you being here with us, because I think it's important to hear, yes, a physician's perspective from a primary care perspective, but it's also important to hear that imaging perspective, because as we talked about for a second, you see what happens inside of our bones through the imaging that you do. And we're focused on the bone health. Kind of, we want to talk about prevention, early detection, and osteoporosis. So what are some things you do see in women specifically, because it's Women's Health Month, who have issues with bone density health?
You know, honestly, the big thing that jumps out is surprising how many women actually suffer from decreased bone density, and even more surprising how many don't even know they do. 1 in 2 women actually have some degree of bone density loss, and that's 50%. That's a scary number if you think about it.
Yeah.
If you think about it. And so you can kind of think of osteoporosis as the heart attack of the skeletal system. It'll often go undiagnosed until a major event like a fracture happens. So we see a lot of that come in through the emergency room, fractures of patients that didn't even know they had osteoporosis.
Wow. That is the way you characterized it, the heart attack of the bone system. I like that characterization, because it shows you the importance of taking care of your bones. You don't think about it, but this is where our body lives, on our bones. It lives on our bones. It carries us around. So let's just kind of touch on what can we do as women to detect this at an early age.
So the screening go-to for bone density health is called a DEXA scan. It's more commonly known as a bone density scan. Mm-hmm. So it's something that a provider will order on patients to look and see if they do have any form of bone disease.
Right. And I just had one done at our Women's Health event. Tell people about it, what to expect when you get that scan.
So it's a very easy, non-invasive scan. So when you arrive, you'll go to the room with the technologist. They'll kind of go over a couple of medical history questions with you to see if there's any other underlying conditions that can lead to bone density loss. Mm-hmm. You'll lay on the table. There's no contorting into odd positions. There's no IVs involved.
Right.
Depending on if you have any metal in the way, they may have you remove some metal. But you lay comfortably on the table. We take some images of your lower back, usually your hips, sometimes your wrist. If the patient has any metal in the hips, we'll do the wrist as well. And those results, combined with the answers to your medical history question, will help the provider determine, based on your score compared to the population of your age, if you're at risk for fractures.
Okay. So what I had wasn't necessarily the exact same, but it was painless, like you're saying, and very comfortable. You just kind of, I think I did it on my hand, right?
Yes.
Yeah.
So it's kind of a mobile screening tool. So if you have one of those done at one of our events and they detect you may have some bone loss, your provider would then order a full diagnostic one.
Okay. All right. Gotcha. So when you say I go to my primary care physician or my GYN, what do I say to them about, are they going to bring it to my attention, or should I bring it to their attention at an early age? What should we do?
So typically we get a lot of patients that come in for their order with their bone density along with their mammo, because the gynecologist tends to order them together.
Gotcha.
But it doesn't have to be that way. You can have the conversation with your primary care provider. A lot of patients prefer to do that because they have a larger look at the patient's overall health. So the recommendations right now is age 65, and you have it done every 2 years.
Okay.
However, there are some high risk factors that may warrant you having it sooner or at a different frequency.
Okay.
So like early menopause, that means if you have menopause onset before age of 40, they recommend you start at age 50.
Okay.
There's some other health conditions, some endocrine disorders, thyroid, parathyroid disease. There's a list of medications that cause bone density loss. So some anti-seizure medications, long-term use of steroids like you see in pulmonary and rheumatology patients.
Okay.
Some cancer treatments will create decreased bone loss.
Right.
Some lifestyle choices, smoking, excessive drinking, things of that nature, all combined together may indicate that you need to start your screening at an earlier age or do it at a different frequency.
So when you talk about the lifestyle factors and the medications, that just underscores the reason why it's super important to be completely honest with your primary care.
Yes.
They're not going to go gossip about you or do anything with that information. It's private, it's confidential, and it informs the screening decisions that can affect your health later in life.
Right. There's no reason to be embarrassed about lifestyle choices.
Right.
I mean, they have heard and seen it all, and their main focus is to keep you healthy. And if you're not honest and open about it, you really can't take ownership of your health and make sure you're doing all the right things.
Yeah. So it's very important for that. So be honest with your provider. Okay. Just tell them about those glasses of wine or whatever you're doing. So what are some things that you have seen? You know, in the imaging world, so what are some things that you've seen in your line of work that can happen to specifically women, because that's our focus today, because of poor bone health? And we can touch on and men too, but let's just start with women.
So in general, bone health can be kind of scaled on a spectrum where you have normal bone, normal healthy bone. It'll go down to osteopenia where you have decreased bone density, but you're not necessarily at risk of a fracture yet. And then you get down to osteoporosis where it's severe decrease in bone density and now you're at high risk for a fracture. And like I mentioned before, osteoporosis kind of goes undiagnosed often. And so we see a lot of what's called fragility fractures. And those are fractures that occur from a low impact trauma, such as falling from standing or something that wouldn't result in a trauma in a patient that has normal healthy bone or even osteopenic. Those fractures often occur in the spine where you'll get a compression fracture. So this bone will actually compress on itself. The classic, I fall and I can't get up, the hip fracture.
Yeah.
And also in the wrists, actually, from people falling and bracing themselves, you'll get fractures in the wrists. And those patients that, like I said, didn't even know they had osteoporosis.
Right. So we talked, you know, you're talking about how it can go mostly undetected a lot of the times. Is there anything that would raise a red flag earlier on?
Patients that have frequent fractures
Okay.
at an early age, they will definitely start looking to see why is this patient having the fractures. Other than that, knowing your medical history and reviewing it with your provider would be the only way that they would start looking into seeing if you needed to have any kind of screening earlier.
Yeah. And I don't know if this is an appropriate question, you can tell me, but why do we focus on it so much in women?
Women have a decrease in their bone density a little sooner than men. So throughout your life, your bones kind of go through a phase of building down and breaking up, going back and forth, forming new bone. And normally between the ages of 25 to 30 is when you reach that peak bone mass.
Oh, wow.
And women tend to get it sooner than men. So with that and with us reaching changes of life before men and decrease in our estrogen, we tend to lose our bone density sooner. Also, lower BMIs can lead to having bone density loss, and typically women, you know, we're always
trying to slim down,
focusing on our figure, not realizing it could be at the detriment of our bone health.
Yeah. So when you said that we reach our peak in our mid-20s, that is a very important piece of information for every woman that's listening. And why? Why is that?
It is because after that, you're maintaining. You aren't producing anymore to go any higher. So it's really important to put the focus on bone health more in the pediatric, adolescent, early adult years, because that's when you're building that healthy bone. So you can do that by making sure you're getting adequate calcium intake, adequate vitamin D. Vitamin D helps your body absorb the calcium more efficiently.
All right.
Having an active lifestyle, weight-bearing exercises, refrain from smoking, excessive drinking, things like that, so that in that adolescent, early adult age, you build that healthy bone and then continue those habits as you progress through your age.
So you're setting that foundation
Yes.
for the healthy bone.
Yes.
And you know, I remember my 20s, you know, my mid 20s, that was, I wouldn't say it was top of mind.
No.
Right?
No.
So you have daughters. You just told us about your twin daughters. I have daughters. Aside from managing that when they're younger, what are some things you do to kind of instill that in your children, and what should we do to instill that in our daughters?
You know, I try to just talk about overall health with them.
That's good.
They're unfortunately starting at the point where they're talking about weight and things like that with their friends, and I focus on just being healthy. You know, you are what you eat. You put in healthy, you're going to get out healthy. Staying active, we make sure they're involved. You know, the volleyball, softball, they're always in something.
Yeah.
And we make sure before they go to their games and practice, they understand they have to eat something healthy.
Yes.
And how it affects their body overall.
Yeah. So let's talk about one other thing, and this is veering a little bit off topic, and I don't know if you have an answer for me on this either, but I'm going to ask you because as a mom, you might know. What if you have someone who doesn't, because I know a primary source of vitamin D for children it can be milk. But what if you have a child that doesn't like milk?
There's other options. Obviously, the sun is one way to get vitamin D.
Yeah.
So getting outside and staying active. There's leafy vegetables. There's different ways that you can get that. There are supplements. And so as long as you're getting a combination of actual nutritional and supplements to get that value you need, it's fine.
Okay,
It's
good.
fine.
Well, that's good to know.
Yes.
Because I didn't have a lot of milk lovers growing up.
And I have one that's lactose intolerant. So
Oh, wow.
we don't do a lot of milk either.
Yeah, so look for those other options. So is there anything else you want to add on this topic? Anything we didn't touch on? Anything you want to reinforce?
Basically just, I know it can get overwhelming juggling all of life's things as a woman. You're juggling work, home life, kids, all of those things.
Right.
Trying to balance all the screenings and recommendations, how many hours of sleep, how many hours you sit and stand, and you can go on and on. But it's really important to take ownership of your own health.
Okay.
Have the conversations with your provider and make sure that you're crossing all your T's and dotting all your I's.
All right. Well, thank you again for joining us. This was enlightening for me, and I hope it was enlightening for you. Thank you so much for joining us on this episode of Healthy Living, and we will see you next time.